Hello everyone, my name is Lorraine and my group is gonna present the assessment one, which is me, Lorraine, Tian Tian Ma, and Dara Marine. Our topic is COVID-19 in Broome that located in Kimberly, Western Australia. And the theories and framework is about the public health emergency focusing on the capabilities to prepare for, respond to and recover from public health emergencies. The method that we use is identifying and evaluating risks to minimize the impact of emergency, community engagement and education, involvement and informed participation. The framework is that we choose health as our topic and research on how hospitality during COVID-19 can improve, such as the quarantine center, hospital, housing, and public area outdoors. The first precedent study that I choose is architecture. This is located at Wuhan in China. It's a quarantine center that built just in 10 days. The emergency facility is made up of 2 floors and have about isolation wards and 30 intensive care units, which is ICU. It can hold up to thousands patients. The material of this including steel frame, the building and the cladding. Isolation people will have a safe distance and having enough medication machine for them. The second I choose is the graphic design because it plays a crucial role in addressing a variety of issues during COVID-19 pandemic. This is important information promoting health and safety measures and fostering a sense of community. The first one is public health information. Infographic has been widely used to present complex health information in easily understanding format. They illustrate how the virus is spread and symptoms to watch for and steps to take in infective. The second is health and safety signage. The icons and symbol help convey important health message quickly, especially in diverse communities with varying language proficiency. The third one is education campaigns. Social media graphics and animation have been used to spread awareness about COVID-19 and encourage healthy behaviors. The last one is emotional and mental health. Graphic design has supported campaigns promoting mental health and well-being, offering tips on managing stress and staying connected during lockdowns. And now move on to the site analysis of the place that we choose, which is Broome, Kimberley, located in Western Australia. The climate condition overall is about it's divided to two, which is wet season and the dry season. Wet season, which is about November to April. The daily temperature range is about 25 to 33 degree, and it's a very humidity that about 80%. It also have heavy rainfall during this period with an average around 600 to 700. During dry season is from May to October. In this period, the daily temperature is from 15 degree to 30 degree. Normally have low humidity about 60% and has no rainfall. The impacts of human during wet season is that they have a health high risk to get sick because particularly for those with respiratory condition, which could be complicated for COVID-19 as well. Heavy rains and flooding can be isolate communities, making access to healthcare challenging too. The economic impact during wet season generally less tourist activities, but during the pandemic, tourists was further restricted, so it led to economic loss. At the dry season, tourists is normally a peak season for them, but in COVID-19 travel restriction so impact tourism as well, leading to economic strain on local businesses. The isolation and economic uncertainty caused by a pandemic could contribute to increased mental health issue. And the impact of nature is about wildlife and natural environment. So it reduces human activity. During COVID-19 pandemic, it reduced tourism and human activity led to less environmental disturbance, potentially benefiting local wildlife and ecosystem. Decrease of vehicle emissions and less foot traffic in natural areas may have lead improved air and water quality and less littering. The last one is the conservation challenges. Limited funding and resources for conservation efforts due to economic constraint might have hindered some ongoing environment projects. The community resilience of Broome community has had to adapt to both climate conditions and restriction imposed by the pandemic COVID-19. This includes shifting towards local resources, increasing reliance of digital communication, and developing community support network. Next, I'll be talking about the site map that I got from the satellite online. So this is the map of the Broome, Kimberly, and the light green color indicates the drainage system of the whole area, while the dark green color indicates the forest and the nature. And the last one, which is the red color, which is the traffic flow of the area. So next, I'll move on to my group mate to continue. Thank you.
Hi everyone, I'm going to present the fauna and flora found on the site. Knowing the plants and animals in the site will help us design something that will minimize potential problems to the site. One of the plants and animals may include one of the plants may include the pindan woodlands, the eucalyptus species, the various shrubs, the grasses. The areas may also contain coastal vegetation like the mangroves and also coastal dunes, salt tolerant plants, seasonal wetlands, and many other type of fauna or flora. Sorry. Um, the region also supports a wide range of animal species, which may include the shorebirds that migrate from time to time, and also the rainbow bee-eater. Other native species are the northern coal, the various bat species, and not forgetting the dugongs, which live in the coastal waters. And in addition to that, the region is home to a variety of reptiles like the frill-necked lizard, the olive pythons, and frogs, especially in the rainy season, not overlooking the abundance of the water life, which includes the fish, the crabs, the corals, and famously known for having the flatback turtle. How our designs have been incorporated to blend in is the sustainable landscaping, whereby we shall use the native plants to preserve the ecological balance and benefit the wildlife around it. Also, planting species that can aid in supporting soil erosion and preserving the natural landscape, and also use not forgetting the use of water sensitive design techniques, which can also be an additional component that will help manage the storm waters because it's prone to flooding, and not forgetting minimization of minimizing the visual impact, like getting materials and designing something that blends into the surrounding and the natural landscape. There are also many ways the site may be hindered by the fauna and flora, which may include the possibility of animals like the northern crows destroying the design while looking for food, and also it may have an effect on the vegetation because the construction projects have a potential to harm it, and also light and noise pollution, which may be annoying to the nocturnal animals like those birds that are nesting. Also, the potential dangers that may affect the site may include the unpredictable weather conditions, which may include the tropical cyclones, floods, rain, strong winds, heat waves. Extreme temperatures is also another thing that is a potential danger. Another potential danger is the bushfires. Then also, except the weather, we have other potential dangers like the spiders, the snakes, the dangerous creatures, kangaroos. All those may be potential dangers that may be a hindrance in the site. Strategies that we thought of for the mitigation is using reinforced materials and solid foundations to endure strong winds, use of elevated platforms to aid in keeping the in due to the possibility of the floods. Additionally, we also thought of checking the designs to make sure they're insulated to keep the temperatures reasonable. We also thought of lowering the chances of fire by use of fire resistant materials. We also thought of construction of windows and tight seals, which will keep animals away, and also erecting barriers. Another thing is the insect management, whereby we shall keep the mosquitoes out of the house and install mesh, which will help to capture them. Integration of the design, we thought of the modern air filtration systems and integration to guarantee clean air. We also thought of cooling methods, which will also keep the temperatures reasonable, and also design with the input of the indigenous communities to guarantee community support as we make the designs. Another thing we thought of looking at were the inhabitation analysis, which include the cultural values. The Broome region is really culturally diverse, and we focus more on the Yauru people who live both on the land and the sea, and they have a strong culture and spiritual bond with their ancestors, and they are connected to the land. Another thing is they have a high value on family support and community solidarity. Which another one is it is essential to them to preserve and revive their language, their customs, and their knowledge exchange, which is critical to ensure that all the traditional practices are respected as we are designing. I'm looking at how we could design something that will keep the culture integrate will keep the culture values. We thought of sourcing locally environmentally friendly materials from the community, which will keep the surrounding environment the same and also respect the values in our design. We also thought of garden spaces since they're connected to land, which will create a more relaxing place connecting them to the land. We also thought of creating designs that flexible layouts that will accommodate the families as well as individuals, providing flexible use. For example, while preserving social distancing, whereby they'll have community meetings and they'll socialize, and they'll have cultural events like storytelling and customs, which will keep their preservation of their culture while again going ahead with with isolation. Also, another thing is we thought of conserving their culture heritage by instilling their language and artworks in the designs. We went ahead to look at the political context too. It is essential to comprehend the political context of the individuals we are designing for. The Broome region it has a strong political connection. Here, the political context is it's okay, they clearly support they want to create a suitable and political environment. Like many Australian indigenous groups, the rural people support land rights, self-determination, and the preservation of their traditional history, maintaining culture over their lands, and they want to be included in decision making, which is important to them politically. So ways we thought of creating plans that will help create a politically friendly environment is through consultation. When you consult them, it will make them feel inclusive. That is community input, interacting with them. Interacting with their local governments and other community organizations to guarantee that the designs line up with their political and cultural values, arranging feedback sessions from them, like open forums and workshops to get ideas for their designs, and also ensuring that they are represented as a culture and made stakeholders, regional stakeholders, as we are creating the designs. Also cultural areas, we looked at the culture designing for like certain sections that will keep their cultural practices or political practices alive. We also thought of compliance with the health and safety. Looking at the regulations around COVID-19, we have to incorporate them in our design, not forgetting that they're COVID-19 management specific laws. So following these will help us to make a design that will be politically friendly to the society or to the region around them. Thank you.
How might those inhabitants with special needs be cared for? Provide telemedicine services in order to reduce direct contact with people at high risk while ensuring they have access to necessary medical services. Telemedicine services have been widely adopted in Kimberly region. Specialized medical and mental health support. Kimberly Aboriginal Health Services and other local health institutions have strengthened their mental health support services during the pandemic. These services include providing psychological counseling and support to help residents who feel isolated and under increased stress during the pandemic, increase mobile medical services. In order to better cover remote and inaccessible areas, Broome has increased mobile medical services. These mobile clinics can go deep into various communities to provide regular checkups and emergency medical services to residents with special needs. Community involvement and cooperation. The Kimberly region's epidemic response strategy also emphasizes community's involvement and cooperation. By working closely with Broome leaders and organizations, it ensures that people with special needs receive the necessary support and resources during the epidemic. What potential dangers might arise as a result of these inhabitants? Medical resources. Broome may lack adequate medical facilities and equipment, which could result in a lack of timely and effective treatment of critically ill patients and increase the mortality rate. The hospital can be expanded in the shortest possible time and medical equipment can be added so that all patients can receive timely treatment. The particular vulnerability of indigenous communities. Broome has a large Aboriginal population who may have higher rates of chronic conditions. The government should provide them with free regular medical checkups, strengthen economic subsidies, and improve the living environment of the poor. Health and living habits. Poor hygiene and crowded living conditions in some households increase the risk of virus transmission. Communities should strengthen the construction of infrastructure, improve the living environment of local people, and actively promote health knowledge to ensure people's basic living standards. Mental health. The ongoing pandemic may have a negative impact on the mental health and social relationships of community members. The government should set up a free psychological counseling telephone and call volunteers to regularly communicate with these infected people to ensure the mental health of those infected. What chronic issues or ongoing human rights emergencies affect those inhabiting? Adequate health facilities, shortages of medical equipment, medicines, and professional health workers have left communities unable to cope with the large number of COVID-19 cases and other medical needs. Mobile health services can be increased and telemedicine consultations can be provided to ensure that residents in remote areas have access to necessary medical support. Mental health issues. The pandemic has caused many residents, especially members of the Aboriginal community, to face serious mental health issues such as anxiety, depression, and isolation. Mental health support services are available, including telephone and online counseling. Community support activities are provided to help residents maintain social connections and reduce psychological stress. Economic woes. The pandemic has led to reduction in economic activities, and many families have lost their income sources, increasing their living pressures. Poverty and unemployment have further intensified during the pandemic. The government and non-governmental organizations provide financial assistance and employment support programs to help families tide over the difficulties and promote employment opportunities in the community. What emerging or potential issues or ongoing human rights emergencies affect those inhabiting? Sustainability of health resources. As the epidemic continues, ensuring the continued supply and management of medical resources have become a major challenge. A comprehensive medical resource management system can be created to optimize resource allocation and ensure timely replenishment and distribution of medical supplies using data analysis and predictive models. Inequality in vaccination. Due to Broome's remote location and inconvenient transportation, some residents may not be able to get vaccinated in time, increasing the risk of infection. Mobile vaccination vehicles and remote vaccination stations can be designed to ensure that residents in remote communities can easily access vaccination services. Social and economic inequality. The epidemic has exacerbated poverty and unemployment in the Broome area, especially the impact on the Aboriginal community is more significant. Community economic support and employment training projects can be developed to provide skills training and entrepreneurship support to help residents improve their employability and economic independence. Thanks for everyone.